were using blood platelets, patient cells, and bone marrow concentrating them and using ultrasound and fluoroscopy, putting them into an arthritic knee or a damaged spine or a rotator cuff. People want alternatives to surgery. So it was a low barrier to entry for others to come in. And there are a lot came rushing in 10 years ago, a ton. And it really was a Wild West where you didn't know if you were getting the real thing, anything good, if the doctor was qualified, what they were putting into you. How do you know? Is there any research?
Welcome to Healthcare Liberty Labs with Tiffany Ryder, where we teach you what they don't want you to know about healthcare.
Like, I appreciate that he's trying to talk to me, but also, like, I'm sure we're on a time schedule. And then at some point I was like, should we do the thing? And he was like, oh, we started recording like a long time ago. And then you start doing that thing where you're like, well, what did I say? like, did I look okay? Is my shirt up? Like, you know what I mean?
Yeah.
So I don't know. I like the style, but it's a little intimidating sometimes. I want to talk about functional medicine, and I want to talk about like all of the things that are sort of outside of this, does my insurance pay for this discussion, like things that I personally have experienced and believe can be helpful, like acupuncture and chiropractor services, physical therapy, things like that can either be life-changing and really excellent, or it can be super hokey. And I think it's hard when you don't have a clinical background to really sort that out. So I'm hoping to dig into that with you today.
Yeah, I'm excited. This is an exciting topic for me because there's so many ways to heal. But if you end up with the hokey and spend a lot of money and don't get anywhere, it's hard to come back and want to try it somehow again. Or the flip side, which I know we both see, people default to whatever their insurance will pay for, even if we all know it's not going to be good for them. Yeah. But because it's paid for, they do it. So we have to protect people from getting crappy care going down that road and getting crappy care getting out of the system.
Yeah, absolutely. And, the ironic thing about what you just said is that, a lot of times people will say, oh, I'm going to use this because my insurance pays for it. And then when you sort of break it down, you're like, well, if you'd gone to, 3 chiropractor visits, that probably would have set you up and gotten you in a better position than, maybe you're in right now. And it actually would have cost way less than your deductible, for example. Right. So it's not even as clear cut once you dig into the details. But can you start with where you're coming from in this discussion?
Yeah, thank you. I'm coming from over 30 years. I'm not going to give the exact number, but it is over 30 now.
Come on, Mark.
I know. It doesn't look like it, does it? Thank you for saying it. Of taking care of patients. And I'm trained as a chiropractor. I learned acupuncture and dry needling, and I studied in China for some of that time. And I was literally starving to death in the 90s. Like, I didn't know. And I was like, where are the patients? How am I going to get out of this? And they were with the physicians. And so I had to find my way. How in the 1990, when I got out of school, people didn't like chiropractors, especially physicians. But I wanted to integrate with them. I thought that was a great way for, one, me not to starve to death because they could refer me patients, and two, where I could bring some value to them and their patients that they just weren't providing and couldn't provide. Wasn't their thing. So once I figured that out, I spent the last, about 30 years working in pain management, orthopedic surgeons' offices, a lot of that in primary care. I'm the first chiropractor on the medical staff of a hospital here in Denver and work in an integrated musculoskeletal clinic. And so I've seen a lot of that, the acupuncture stuff. I got trained in functional medicine by the founder of functional medicine, Jeff Bland, in the late 90s. And I want to talk a lot about functional medicine because I think it has a real capability of helping people get better and learn how to stay well. But there's also a lot of that term thrown around a lot. What is, it's a catchy term. So So yeah, that's my background. And I taught anatomy and physiology for 7 years in an acupuncture college. We did cadavers sometimes at University of Colorado. We were the only ones they let in there. And so I've just seen it a lot, and I like to teach and I like to educate people. I want people to know it's not that hard. It is complicated, the system, but it's not that hard to be healthy. And so that's been my path and my mission, and started lifting weights in 9th grade, right? I started working out, started eating good. And that was my, trajectory into natural healthcare and then integration.
I had no idea, honestly, as many times as we've talked, I had no idea that you had come from an acupuncture background, but that is what sold me on this concept of, I just don't really know what I don't know. So I had some pretty bad reflux problems. I had tried a gluten-free diet for years. I had tried, the Protonics, the proton pump inhibitor that the doctors give you for this. I had tried the H2 blocker, so the other over-the-counter stuff. I was on multiple meds for many years and was just really struggling with this horrible reflux. I was living in Germany, and someone said to me, it was a doctor. It was, I think it was my primary care, said, "Oh, well, why don't you try this acupuncture clinic?" And I said, is this a joke? Right? Because in the US, you would never have a primary care doc or, at that time, send you over to this Eastern medicine clinic. And he said, yeah, just try it, whatever. And over there, I didn't have to worry about health insurance because I just paid for everything in cash. My primary care doc was 26 euros for a visit, so it's just a little bit different flavor there. But anyway, I went to this acupuncture clinic. I was super skeptical, wouldn't take any of the herbs, wouldn't do any of the things that they told me. They told me to quit drinking coffee. And I said, no. But I did go to the appointments, and I'm telling you, it cured my reflux. And, hokey or not hokey, whether that works for everybody, I don't know. But that was my experience. And then I said, man, oh man, there are some things that we just don't know, that I don't know. And it was at that point that I started looking into some of the things that you mentioned, like functional medicine and chiropractic. And it became really clear to me that I was ill-equipped to know who the people were who were really good at marketing and really good at sales and really good at making me feel good about myself, and who the people were who were actually good at their job and well skilled at that, right? And knew what their scope was, what their limitations were, and when they should refer me to someone else and all of that. And so I can't even imagine what that looks like to you, right? Having been involved in all of these areas. So how do you even begin to look at that problem and start peeling the onion of what's important and what isn't?
Yeah, well, not just credibility, because physicians, or if you have a degree and it letters behind your name, you get this automatic credibility, but that's not the place to start, really, to your point. I'd say this is what I tell people with chiropractic and acupuncture. If it's going to work for you, it's going to work pretty quickly. You don't have to go for 30 visits. If somebody's pitching you on 30 visits for something right up front, especially if you're going for pain, if you're going for other things like curve restoration in your neck, that's going to take some time. But, it's somewhat about the outcomes. But how do you know? In the clinic, we know, and as a clinician as well, there are people in your community that like and trust because you see their patients back, or they're your patients that went to them and you see them back. So you get that immediate feedback from the patient, not just the note that the surgery went well or whatever went well. So that's a great tool. There's residents here at the hospital I work with from University of Colorado. And the first thing I tell them, and I whisper it, do not work with this doctor. Do not refer to this doctor.
Yeah.
So that's one thing. And so I think
we all know that, right?
Yeah.
Hospital systems across the country. You ask anybody who's involved in a hospital system, be like, hey, do you know 5 docs that you would never let your mother go to? Of course. I do. Right?
So we need to share that amongst each other because we are making some of those referrals. When it comes to chiropractic, it's kind of the same thing. There's some really high quality networks out there. Arete Health is great. They track a lot of stuff. They know a lot of things. I go to one of their network chiropractors here. They are great. I always tell my guy, you are so much better than I ever was at this age. And because he's younger than me.
That's awesome.
And
yeah.
I was like, you're just great. Plus they teach them differently than I learned. And so if you can find a high quality network like that, and they'll show you their outcomes and things like that. And then, you know, you talk to your friends. I think friends, people, they'll level with you, right? I have a friend in the neighborhood, another dad. I referred him to my guy, and I saw him a few weeks later, and he thanked me so much. So I think that sort of like from the top down clinician kind of networks, maybe some they're tied into your, you know, are they transparent or are they just a middleman? And in the alternative medicine world, the middlemen, they're just moving us around and taking a chunk of the money and putting prior auths in front of us. When people go to a chiropractor or a PT, non-prescribers, the data shows, and it's shown for 30 years, that people get less imaging, get fewer injections, get fewer surgeries. And so if you can find that kind of a network, it's totally worth it. But your friends on boots on the ground are great too.
Yep. It's funny because I ask that question pretty much every conversation I have with people, just because I think that the concept of quality in healthcare is something that, you know, organizations pretend is really easy for them to capture. And, you know, everyone likes to boast about their quality, but once you're on the inside, you're like, no, all of this is a dumpster fire. Like
and we're looking around like that, right? We're like,
like I would never go here, and here are the 16 reasons why. And so it's funny. So I always ask that question, and I feel like the answer you just gave me is pretty consistent across the board. You know, ask around, see what who are your friends using? How's it going? I have two, I guess, follow-ups to that. The first one is more in your wheelhouse. You and I have a mutual friend and acquaintance who, you know, recently was going through some back issues. And he asked me, and I know he asked you because he told me, and he said, hey, like, I'm having this pain. I went to my chiropractor. My chiropractor's pretty familiar with me. I've gone to him for a while. You know, here's what I'm experiencing. What do you think? And, you know, I'm like, well, I don't know. I haven't touched you. I haven't like laid hands on you. I don't know what I think. But, you know, I do know that I've had patients who have told me that they, you know, have gone to a physical therapist. They've done some dry needling. They've done some manual therapy. And I know that those patients have gone from, I can't walk because it's too painful and I need to be in the emergency department, to, okay, I'm a little functional and I'm going to make it to the orthopedist next week. So I said, you know, you might want to call Mark and ask him if he thinks that, you know, you might benefit from going to a physical therapist. And he asked me the question because he's a smart guy. And he said, well, do you think that's going to be any different than than what my chiropractor can do? And I said, okay, you got me. I have no idea. Like, I just have no idea. And I think that like even in that space, like, how do you know, right? If I could send him to my physical therapist that I know, like, and trust, I feel like I would say, yeah, it's worth a try. But it's really hard to give those blanket recommendations. It's hard to know how to navigate situations like that. You know, what do you think is the key, I guess, question to be asking when you're in these situations? Like, I need help and there's 3 different alternative ways to go. What do I do?
Well, his question back to you, I think, is pretty accurate. There's going to be differences. There's still manual therapies. But I'll tell you what, this guy was so acute and miserable and could not budge. And look, I've been seeing those patients for 35 years. I don't even adjust them. If they come to me, I'm like, go back home. Come back when you're calmed down. What am I going to do for you? I can do some acupuncture. And that's going to help you with a pain, maybe a little bit, but not really like what you need. I'm the holistic guy. If I'm telling you, you need to go home and take some drugs, it's because I know the pathology of this problem. PT, an exercise, a glute bridge ain't going to help.
Yep. That's interesting. That's a really great. I feel the same way. I'm like, look, I'm never going to be the person who's like, oh, you need drugs. But sometimes you need drugs.
Yeah.
Same with surgery, right?
Yeah. And we went down a rabbit hole of alternative things, and none of them were really doing it fast enough. And I understand the decision he made. And the doctor I referred him to said, this is probably not going to help you fast as you want it to. And looking at the anatomy, you should probably get surgery. And that's somebody who knew a lot of, who to refer to and when.
I think that is probably a key takeaway that, listeners could pay attention to. If you have an alternative practitioner, I even hate the word alternative because it's like has a connotation associated. But if you have an alternative practitioner who is never going to say that you need drugs, who is never going to say that you might need some imaging or to be referred to a physician or a surgeon or something like that, like that's a red flag for me. If you think that the less invasive therapy is the only answer, that's a red flag. Yeah. Obviously, the same is true of a clinician, where if you think that medicine and surgery is the only answer, also a red flag.
Yeah, exactly. That swings both ways. I completely agree. Holistic means all of it. And it's knowing when to use it and when to refer.
I love that you brought up this question of acuteness, which, for people who aren't in clinical medicine is just like, does it need to be done right now? Does it need to be done 5 minutes ago? Or is this something that, maybe has been going on for the last 10 years and doesn't need to be handled in this very moment? And I wonder if that's a good starting place as well. I shadowed in a functional medicine office a couple of times, and I thought these trigger point injections were really interesting. For people who don't know what that is, have you done them, Mark? Because
I've done them, but I'll tell you, they should be replaced with dry needling.
Okay. So and that makes sense to me, actually. I was familiar with dry needling when I saw it, but essentially my understanding of the way it works, again, I've never done it, but it's a little bit of saline, and then the needle goes into a particular point on the muscle and is sort of interacts with the muscle, we'll say. The saline goes in there, but it seems like whatever benefit people are getting is from this physical manual manipulation, for lack of a better word, to the muscle or to that area, which speaks to your dry needling point. But, patients are like, oh, well, should I try that? And, on one hand, could it be a waste of time? Maybe. But on the other hand, has anyone ever really died from saline? Like, if it's done correctly, I would imagine the answer is no, right? So there is a risk-benefit calculation that likely needs to happen here too.
Yeah, there is. And so, yeah, right. You got to weigh it out. And is that, because, you can only do so many of those. So if it's a regional pain problem and you've drilled down that it's not, and that's the thing about diagnosing. Is it joint pain? Is it nerve pain? Is it referred pain? Is it myofascial pain? That dry needling or injecting into those trigger points, that's myofascial pain. So if you're just guessing, you're giving the person the wrong thing. I just listed off 4 things it could be. It's probably even greater than that. It's probably 10. And if you're picking this because that's your hammer and everybody's getting it, and who's going to be, somebody's going to have a reputation for doing that, should avoid that person. But yeah, that's true. And the dry needling actually came from it, because your point is true. It was less what they were putting into it. Sometimes it's steroids, sometimes it's lidocaine, sometimes it's both, sometimes it's saline. But they really realized it was the disruption of the signaling in that trigger point or in that neuromuscular junction just from the needle. So I see less and less injections now. Go ahead.
Yeah. So, and dry needling, for anyone who has not had the pleasure of having a needle jammed into their body for no good reason, is essentially just that, right? It's just the needle going in and moving, shaking things up, and then leaving.
Yep, exactly. And yeah, and that the body thinks it's an injury, a little lesion, and it starts this whole healing reaction. So you're really doing a regenerative kind of procedure is what that, very low level versus where you could go with that. But yep, body knows what to do.
So, as consumers are, I don't know, looking to navigate things better, looking to not get duped by, someone either who's classically trained and is participating in a system that's taking advantage of patients that are vulnerable on behalf of the hospital and the insurance company, or, a clinician who is trained in some other way who might be doing it for their own personal gain. It's hard to sort out. It's hard to sort out what to do. I love talking about what you guys do I know you do some consulting with Regenexx.
Yeah. Mm-hmm.
And I love talking about that concept, and I'd love to have you explain it for our listeners, but that concept is something that I learned about, years ago, and it was like, oh, this is crazy. This doesn't work. And then, if you have the training to be able to read the studies and start looking into things and a little bit of healthy skepticism, you realize, oh, this, methodology is actually helping a lot of people avoid surgery. Not everyone, but it is a step before surgery. So I'd love to just talk about, what Regenexx uses, sort of how you guys look at orthopedic issues, but in the context of, if this is true in orthopedics, it's likely true in other areas of medicine. And how can we learn from this approach?
Yeah, that's a great question. I'll start off with anything new or outside of traditional, let's change it to allopathic medicine. Anything outside of allopathic medicine is considered too soon, not ready for prime time, quackery, in it for the chiropractors have been labeled that. So anything new, regenerative medicine in the United States, particularly Regenexx, has been around for 20 years.
Interesting. I had no idea. All right.
Our founder, Dr. Centeno, was the first person in the U.S. to use patients' own bone marrow derived stem cells to treat osteoarthritis. And to this day, 20 years later, and I'll get around to your question, we're using blood platelets, patient cells, and bone marrow concentrating them and using ultrasound and fluoroscopy, putting them into an arthritic knee or a damaged spine or a rotator cuff. Now, because that's taken off so well, people want alternatives to surgery. So it was a low barrier to entry for others to come in. And a lot came rushing in 8 years ago, a ton. And it really was a Wild West where you didn't know if you were getting the real thing, anything good, if the doctor was qualified, what they were putting into you, all that. Thankfully, that's calmed down a ton. But how do you know? And we talked a lot about that. Do they have any research? Is there any research? And if they're citing people's research, are they citing the right research? Because there were all these websites out there and people were saying, oh yeah, it's great. It heals, cures, regrows, everything. Here's the studies. And I'd go look at them and I'm like, this is not the study that reflects any of that. So there's that. The physician. Who are the physicians and what are their training, right? So that's kind of how you can separate something that's a little too early, prime time, crazy, wacky, versus the real thing, and looking for credibility in that. Do they have any data on what they say they're doing? And are they continuing to contribute to the advancement of this field through research, clinical trials, randomized controlled studies, things like that? And so that's how, that's what set us apart as a physician licensed network that does this across the country, is all of those different things. And that's kind of on the early adoption side, although it's 20 years in and this is part of orthopedic medicine now across the US. You got to look for those kinds of things and not just take someone's website for their word.
Yeah, to go back to our friend, he ended up going to a doctor, apparently the one that you had referred him to, and he said, he had texted me, he said, hey, I went to the doctor. Here are the things he said. What do you think? Right. And I'm certainly not the expert in, this particular area, but it was immediately apparent to me that this doc knew what he was talking about, that he was very good at his job, because he used phrases like, look, this may not cure your problem. I've looked at your stuff. You may actually need, a different treatment that's more invasive.
Yeah.
But I think it's safe for us to try this.
Yeah.
But, actually, in my experience, right? And so, like, this is the way he couched it. In my experience, about half of the patients who do this thing that I'm recommending end up needing to do it again, 4-8 weeks later. And, maybe 20% of the other patients, it cures their problem forever. And, 20% of the patients, it does nothing at all. And, we don't know. Anyway, he goes through this thing, and there was something about like the phrasing of like, here is my experience. Like, this is what the research says, and I know these things. And then, my anecdotal experience shows me this, but there was a humility in the way that the question was answered that said, look, I don't freaking know. Right. At the end of the day, I can't promise you anything.
Yeah.
And it may not be the last step, but why wouldn't we do the less scary thing before we do the more scary things? And I really liked that, and it really sat well with me, and I think it supports a lot of the things that you're pointing out here.
Yeah, that's great, right? And you can tell when there's that sort of level of communication versus the hypey kind of stuff that's overpromising and just sounds too good to be true. If anything sounds too good to be true, it's too good to be true. That is true.
Know. Is it true? Acupuncture cured my reflux. That sounds too good to be true, but it was true.
You're an N of one. I've been around it a long time.
Is that not normal?
No, I don't want to say normal, but like we just talked about, just like we talked about with our friend, you got to have some humility. Like it may work, it may not work. You're coming with your biology, your genes, whatever's been going through your brain for your whole life. And that's stuff you can't control.
Yeah.
When you treat people.
Yeah. True story. True story.
Yeah. This episode brought to you by Crowd Health. Crowd Health helps you find awesome doctors, negotiate your bills, and fund those bills through our peer-to-peer funding platform. For less, welcome to an easier way to pay for healthcare.
Well, I have another question about functional medicine. So I've also had patients who have, I'm full of them, who have like, there are a lot of people who are starting to become aware that the microbes in your gut, the germs that live in your gut are, have an impact, we'll say, right? They can have an impact in a ton of different ways. I don't know if you've read Marty McCary's latest book.
I have.
We were with Marty last time we were together.
Yeah.
But, in the book, right, he's got this entire chapter on antibiotics and the effect of antibiotics in childhood. And there were some studies in there. I went on a deep dive. There were some studies in there about giving probiotics as a treatment for not a solitary treatment, and as an adjunct treatment for schizophrenia and bipolar patients, and how that affected the frequency of different episodes and readmissions for the hospitalizations. And I guess this is an area that I feel like functional medicine, again, to your point of early, but right, or early and crazy. I don't know. But, they've been dealing with this, I think, for years. We're just now starting to recognize it sort of full scale. But there's all this testing, right? I always have friends come to me and they say, the functional medicine doctor wants this $1,600 test for, my gut biome and this genetic marker and that. And, it's always sort of a difficult question for me, because what the heck do I know, right? Like, I know that the biome really matters, I don't know if the $1,600 test is going to do anything for them. What do you think, specifically in the internal medicine outside of the musculoskeletal world, what do you think we should be looking at, or what are the indications there?
With the microbiome specifically?
Yeah, for functional
testing?
medicine. Do you think these tests are doing things?
I do. So let me just start really kind of functional medicine is systems-based medicine. Is my gut broke down? Is my endocrine system broken down? And how are they interacting? Now, those are just two of the systems, but how are they interacting? And so our standard testing kind of just doesn't give us that functional, how is it all working? Let me give you a perfect example. Gut health. So I don't know how much a stool test is. Functional medicine, it's probably $600. The gut, 70% of the immune system is in the gut. So if you've got autoimmune disease, if you've got upregulated something, you've got Hashimoto's thyroiditis, you've got RA, you've got all these things that are immune system based. Even, our pain, inflammation, it all comes out of the immune system. So if you have dysregulation in your body like that, to me and to functional medicine, this is where the root cause comes from. They came up with that term. Everyone uses it now, but where's that coming from? It's probably coming from the gut. So when you're trained in functional medicine, and I would only really recommend people that are trained in functional medicine and certified, and they're easy to find. So sometimes those tests are great. What are you going to get? An occult blood stool test in your clinic? Well, that ain't going to tell me anything. Gut microbiome, that's another thing. What's the diversity? Now, it's hard to just pinpoint it with this or that, with some exceptions. That's not true. But you got to see what that looks like. More diversity, greater health. Hey, if you get a directional answer like that, that's good. If you get the directional answer is like, Tiffany, your gut microbiome is not very diverse. It's not well populated. We need to look at ways of improving that. So functional medicine's kind of looking at these things on a system-wide basis, but going to the root cause first. And the gut microbiome is, it affects how we detoxify medications, chemotherapeutics, everything. So we don't take any of that into consideration when we're doling stuff out to people. But there's probably more control in the microbiome than any other system in our body. All these bugs, there's more bugs in and on us than cells that make us up.
I guess the only pushback I would have, and maybe I answered my own question, right? But I guess my question before I paid $1,600 for a test would be, well, what are you going to do differently?
That's right.
Based on the results of this test. If literally at the end of the day, you're just going to tell me to take the same probiotic mix that you're already going to tell me to do, well, why don't we just skip that and then let's move forward.
I completely agree with you there. And sometimes when people come to me for that sort of stuff, that's my approach too. I'm like, here's where we're starting. I don't really need to do an expensive test if you can't afford it. Let's start here. Completely agree. But you got to have somebody who's experienced and knowledgeable and seen enough of those tests to know this is probably a really good starting point.
Wow. Yes. That is, I think that's it, right? Because I've got to be the worst patient of all time. I'm sure that my doctors hate me. If they can even stomach the thought of thinking about me after I leave. But I walk in and I already have my armor on when I get in there, and I've got a DPC doc who's wonderful. And I say, yeah, I'm not getting that test. I'm just not getting the test. So why don't we treat it based on symptoms? Why don't we do this? And, when we go back and forth and sometimes he wins, most of the time I win. But I think that it's actually probably not the worst approach to go in and say, I'm open to hearing what you have to say. I'm very interested in solving this problem. Help me understand why this test is going to get us closer to where we need to be to be able to do this thing. And, maybe sometimes the answer is, well, I can't give you, testosterone's really dangerous. I can't give you a testosterone shot if we don't know for sure that it's low or, whatever it is. Yeah. And maybe sometimes it's, well, look, I'm going to recommend that you take probiotics anyway. So why don't you just go ahead and do that?
Right.
see what happens.
Yeah.
I don't know.
Right. And then if you do that, like I tell people, try it for 90 days. If you don't feel better, it's not the right approach. I think that's a really good trial there.
I think the musculoskeletal guys and gals, I'm sure, are really good at that, are really good at saying like, look, this is supposed to make you better. And if it's not making you better after some period of time, then it's probably just not working.
Right. Exactly. That's exactly the right, because there's a lot of other things that could be working.
Yeah. Yeah. And it seems really simple, right? Like that's actually not a complex thought that requires a PhD to understand. But like, you'd be surprised, or actually you wouldn't, but like, that's not how we approach medicine. It's not how a lot of people approach medicine.
Right. I know it's not. And so, back to your point about over testing, it's just that can open Pandora's box. So we see patients sometimes who want an MRI on day one. And we're like, yeah, look, 90% of this goes away. That's a big number. Imaging might find something that's totally just who you are, and you might end up in surgery for the wrong reason. So we're not doing it. So there's the argument to not.
I mean, there is an argument to not. It's interesting that you mentioned that. I was on Twitter, I think it was yesterday, and this...
You still call it Twitter?
Well, no, I call it X 100% of the time.
No, I'm curious because I still do too.
I mean, it's so hard to switch. I try to remember, but Yeah. All right. So I was on X, and this doctor that I know, like, and respect was like, made some comment about over testing, and the response, I mean, you could literally just see, and this is not me being arrogant or thinking clinicians are better than other people. Like, that's not it. But you could tell in the comments if someone had a clinical background or not, because the comments were, well, what is the person was saying something about a full blood panel, and they were like, what does a full blood panel even mean? Like, and, it's hard to interpret tests based on, when they're just a number and not a number in the context of symptoms.
Yeah,
and,
right.
And those were the clinical answers, obviously. And the non-clinicians were so frustrated. You could feel their frustration, and they would say, why does my doctor not want to help me? Like, why won't you just do the test? Like, I know this is good for me. I want more information is better. I have back pain. Do the x-ray. I mean, I fight with this all the time in the emergency department. People come in, they want an x-ray of their lower spine. And I say, well, you didn't fall, and there's no reason to do that test for you. It's not really going to give us any additional information. And they're like, why won't you help me? It's like, so I do think that's a frustrating place for patients, that they don't necessarily understand that it's also our job to protect them from going down a rabbit hole that isn't going to make them healthier or happier or safer.
Yeah, exactly. Because that's the whole reason to do any kind of diagnostics, is to help you, be better. But when we know that doesn't help in low back pain, and an x-ray, that is like a useless tool these days. It's not. I shouldn't say that. It has its purpose. But in an acute low back pain, that's not going to help me at all.
Yeah, if I'm really worried about your low back pain, x-ray is not what I'm putting my hand on, right?
Right.
All right. So before we close, I would love to hear a little bit about your experience with cash pay. So, cash pay, things like choosing an imaging center based on, who's going to give you the price for it, or going to a DPC doc versus going to your traditional doc. Are you seeing differences in the quality of care that people are getting and the price of care that people are getting? And how do you think we should be thinking about that?
Yeah, I've been on the cash side, not anymore. I'm employed, and I only do it 2 half days a week, but I've been on the cash side for a long time. I give people deals all the time, buy 6, get 1 free. Because my thing was like, if I can help you, I'll know in 6 visits. But here's a little book, I really do. If I can help, I know pretty quickly. And I was like, and you will too. So it's not just me. If you don't feel better, I'm not helping you. Sorry, where was I going now?
I
Cash
don't know,
pay.
cash
So
pay
I
or
was
no
I was
cash
cash
pay.
pay for a long time. So I love it. I've been negotiating MRI fees for 15 years. I remember first time I overheard it in the office. It was $3,000 on a hospital campus. I was like, what? The outpatient thing, I can get it for $450. And I once negotiated in Las Vegas $150 for an MRI cash. So it's the same machine. It's the same physicians. The doctor doesn't know that you paid $150 for what they're charging insurance $1,500 for. I've been encouraging people to do that and just deal with it that way. And every physician will take cash unless their system won't let them. But most private practice docs, they got a cash price. They'd rather have the money now. I'd rather give them the money now.
Yeah.
And I think, I don't want to say like always the care is better when you do it that way, but like with direct primary care, that's a deal too. We're all spending $10,000 on our high deductible health plans. You might as well pay what, $1,200?
Yes.
And have your doc right
that's
there.
The math I do. Yeah.
Yeah. And they know you and they give you time and they're going to let you, of all people, Tiffany, question them.
They really do. They really do, graciously.
Yeah.
Yeah. So I'm clearly biased, but what in my experience, in my own little world of medicine, I find that a lot of the best clinicians are the cash pay ones. And I think it's because they're the ones who are confident enough to say, I'm tired of doing a terrible job. I can't treat a patient with hypertension and a history of, a heart attack and heart failure and all of this stuff. I can't do that safely in 10 minutes and I'm not going to.
Yeah.
And I'm going to find another way. And, the same with physical therapists and other specialties. It seems like if you're just guessing, just throwing the dice and hoping for the best, that the facilities that are open to cash pay are the ones where you're more likely to get good care. But again, I'm biased.
No, I think you're exactly right, because they were like, I got into this to help people and F the system, because I can't do what are my own values. I'm going to find another way to do it. You are so right. And I've seen some of the best physicians when Regenexx started, they were 100% cash. It's harder, right? Because people want to use their insurance. But there's people out there who value their health more than just about anything, and they think the $1,200 a year to see a DPC is nothing.
Yeah. I got into this with Darrell Finch the other day, and he's a great guy and he gets it. But we got into a little back and forth on this podcast about whose responsibility is it? And I said, he said, your employer is paying for this insurance and they should be providing options that work well for you. And I said, yeah. Okay, maybe. But also, like, who's the person who dies the early death? Like, who's tucking your kids into bed at night, like, because something horrible happened? And I think from that perspective, there's just no other argument. Like, you can't argue that it's the government's responsibility or it's the insurance company's responsibility or your employer. I mean, you can argue that theoretically this would be nice, but at the end of the day, I feel like we're all responsible for what happens to us, because if we're not, then who is?
Right. Exactly.
I don't know.
Healthcare is a commodity, but your health is not. And
that's a great way to put it. I love that.
I can't exercise for you. I can't make you go to sleep. I can't make you eat well. I was going to say, I can't make my own kids go to sleep. So yeah, only you can do that stuff. Right. And if your goal is to be healthy and functional, and you've taken care of a lot of patients too. Everybody's on a spectrum of what they can do, what they know. Their zip code is a bad determinant of health.
Yeah. Wrote about that today too. All right. Last question. We we republished a conversation between the CEO of Crowd Health, Andy Schoonover, and Marshall Allen. So that was our pod episode this week. And in the spirit of Marshall's mission, I would love for you to just say how you go about negotiating these MRIs. You said that you've negotiated MRI prices several times. And I know that that's something that, Marshall was really passionate about, saying, hey, I know it seems impossible. I know it seems like these big corporations and it's just little you, but really like the battle is won by showing up. Yeah. And so if you don't mind just sharing, how the heck do you even do that? What do you say? How does that go to give people maybe the inspiration to just try it?
Well, there's two places to try it up front before you get the procedure, get the service, and just start asking. Thing is, people are afraid to ask. Number one, don't be afraid to ask. Doctors aren't going to bite your head off. They're not going to know. They're not going to treat you differently. You're talking to the front office or the business manager.
We never know.
Never know.
Who has insurance, who doesn't. Like, I have no idea. Don't care.
Right. So number one, don't be afraid and just ask. And hey, do you have a cash price for this? I don't have insurance. You don't have to go into all the details. I have a high deductible health plan. Yeah. You don't have to do that. Hey, do you have a cash price for this? I want to pay cash for it. I can bring you cash, a credit card, whatever. How do you want to do this? How much? And then just stop and let them answer. And they have a cash price, and then it's $450. Look, I'm a negotiator. Oh, that's awesome. Is there any way, and Lee, you got to lean in. Is there any way you can do any better than that?
Okay.
That's an easy question. I've never
tried that. I'll ask for the cash price, but I've never said, is there any way we could do better?
Any better than that? You got to kind of like, right? I've gotten things like that, 50% lower, like that, with one question. It doesn't work all the time, but it's worth asking. On the back end, Marshall's book is the source, right? Get the itemized bills, ask for everything. That slows down the whole process and takes you out of any collection process, and then start working it. But his book is the resource to do that. I love it that he was so passionate, and that's such a helpful book. I've given that out to a lot of people because they get blindsided by the bill, and everybody's been able to lower it. And I love it that taking people to small claims court is awesome, because no system wants to be seen in a small claims court screwing the small person.
Yeah. I mean, and they should be ashamed if that is what's happening.
Yeah. Yes.
Yeah, I think that's really great advice. I know that I tried this a week or two ago. I did some work with a compliance firm, and so I spent the better part of a year hanging out with lawyers, and learned during this time, I don't know if it's always true, I'm not a lawyer, who knows, but I learned that when you ask for the cash price and they say, well, you can't pay cash if you have insurance, I've been told that that's just not true. So I called the dermatologist. My daughter needs an appointment. And I said, hi, I'd like to schedule an appointment for my daughter. And I just really like to know the cash price. And I have insurance through Crowd Health, or not insurance, sorry. I have a relationship with Crowd Health, and that is how I manage my medical bills. And my kids are covered under a traditional plan through their dad. And so I can't actually say that they don't have insurance, because they do have insurance, but I can say I would like to pay cash because I don't want to sort of play into that that market for obvious reasons. And anyway, I tell the front desk person, I'm like, oh, I'd like to make an appointment and I'd like to pay cash. And she said, well, you can't do that. And I said, well, pretty sure that I can. Pretty sure you can't legally tell me that I can't. And I'm pretty sure that you legally have to tell me what the cash price is, or I'm happy to just go somewhere else. And
that's a good one.
Right. And I'm like, I don't know 100% of the time if that is true, but even that method has worked for me. Like even just saying, I would like this price. And then you get friction and you say, well, I don't really know, but this is my understanding. And otherwise, I can just go somewhere else, because the reality is, I think, unfortunately, is that if you don't know the price up front, then you just cross your fingers and hope for the best.
We shouldn't have to put up with that BS.
No, I think it's my job. I think it's our job to push back, give a little friction on that.
Absolutely. Push back and just don't be afraid to do it. And you know, the systems, they will lower it a little if they can, but they are zero interest loans. You can put that bill on a forever payment almost. I had one that came through. They put a device in. It didn't stay. It came back out. I said, I want to pay for that. It came out. I saw him throw it in the Sharps container 7 days later. Oh, no, we already did it. I'm like, bull. And I said, all right, put me on payment plan. How much? I said, $1 a month. She's like, can't do that. How much? $5 a month. And I got it up to this incremental thing. It's been like 5 years. I'm still paying for it. It's the moral. To me, it's the principle that they didn't do the right thing. They overcharged and they wouldn't work with me to just pay the thing down on cash. And so I was like, good, here's your $35 a month for the rest of your life. I know that sounds bad, but the moral of that is these systems will take payments and not charge you interest.
The moral of the story is we have a right and a responsibility to stand up for ourselves and do the moral thing. And apparently all you have to do is just ask.
Just ask.
Well, Mark, thank you so much for being willing to come on and have this conversation. It's been fun. I actually learned quite a bit about medicine and your past. And I don't know, I look forward to seeing you soon.
Yeah, look forward to seeing you. Thanks for having me.
Thanks, Mark.
This has been the Healthcare Liberty Lab. Thank you to our listeners and our sponsor, Crowd Health, for making this possible. Be sure to subscribe wherever you listen to your podcast, be it Substack, YouTube, Spotify, Apple, or somewhere else. We're glad to have you with us on this mission to rethink healthcare together.